Could corset wearing cost a child its life? How does corset use affect the unborn child? Here are some quotes from one woman that lived in the 1800s that understood this subject. Notwithstanding the fact that many women and young girls from native delicacy keep their sufferings to themselves, the very list of these complaints is alarming, and there is no question but the public at large, and even women themselves, have very little idea how much they suffer in this way from the effects of tight dress. It does not end with the individual unless she dies before marriage or so utterly disables herself that she cannot bear children at all, which is not unfrequently the case. If not quite so bad as that, she is still often unable to complete her time, and the little one falls out of being from sheer lack of the vitality which the mother has not been able to give it. She cannot take nearly breath for one, much less for two. A large portion of the alarming number of miscarriages in respectable society is directly due to tight lacing. I met a lady a few days since who would have been a beautiful and queenly woman, but for this deformity her waist was less than half the circumference of her shoulders, and I was not at all surprised to learn that a few months before she had come within a few minutes of death from this cause. In many cases where the child lives, it drags out a feeble existence, and the mother piously tries to be resigned to the will of Providence. She never dreams that it was through any fault of hers. Very many children are born with their blood tainted with scrofula. Now, scrofula is a form of tuberculosis affecting the lymph nodes, especially of the neck. I learned this on Answers.com. So she says, again I'll read, very many children are born with their blood tainted with scrofula through the wrong habits of the mother in her eating and dressing. The very many miscarriages that now occur may generally be traced to fashionable dress. Lacing causes displacement, and this character of disease is increasing with each successive generation. Many suffer years without making their condition known. They remain in ignorance of the cause of their difficulties and endure sufferings which it is impossible for language to express. Not a few women have strength sufficient to carry them through the period of childbearing. Either her own life or that of her offspring is frequently sacrificed. If both live, she cannot be able to give her offspring physical vitality sufficient to withstand accidents and prevailing epidemics. Any trifling cause may put out the feeble flame of existence. By lacing, the internal organs of women are crowded out of their positions. There is scarcely a woman that is thoroughly healthy. The majority of women have numerous ailments. Many are troubled with weakness of most distressing nature. These fashionably dressed women cannot transmit good constitutions to their children. Poor children born of these miserable slaves of fashion have diminished vitality and are predisposed to take on disease. The impurities retained in the system in consequence of imperfect breathing are transmitted to their offspring. I took a look at the statistics for longevity over the last 160 years on the internet, and I found that life expectancy in the 1850s was 39 years. Much of this was because of the frequent death of infants and children. I also noticed that during the years when the use of corsets declined, the life expectancy correspondingly went up. So as the corset use decreased, longevity increased. From what I can see, The author of these quotes is correct. Is it worth the risk?